Warning signs of artery blockages. Imagine waking up feeling perfectly healthy, only to discover your arteries are clogged and your heart is at risk. Artery blockages are silent, sneaky threats that often give no warning until severe complications like heart attacks or stroke strike, affecting millions globally each year. Cardiovascular diseases claim nearly 1 million lives in the US alone, often catching people off guard who are unaware of their risk factors like high cholesterol or hypertension. Today, we're unveiling the 9 crucial warning signs of artery blockages. Recognizing these signs can be a game changer for your health, empowering you to act before it's too late. We'll delve into the subtle, often overlooked symptoms such as unexplained fatigue, chest pain, or sudden shortness of breath, signals that your body might be in jeopardy. Join us as we explore these red flags and inspire you to adopt heart-healthy lifestyle changes. Remember, prevention is your most powerful tool, and even small changes can have profound impacts on your health. Let's take this crucial step towards a healthier heart together. The first sign to watch out for is chest pain or discomfort, often described as a feeling of pressure or squeezing. But what's happening inside the body to cause this discomfort? At the heart of the issue is atherosclerosis, a condition where plaque, a sticky mix of fat, cholesterol, calcium, and other substances, builds up in the walls of your arteries over time. This plaque hardens and narrows the arteries, restricting blood flow to various parts of the body, including the heart. When this occurs in the coronary arteries, those that supply the heart muscle itself, it limits the amount of oxygen-rich blood the heart can receive. When your heart doesn't get the oxygen it needs, it can't function efficiently. This triggers pain or discomfort in the chest, often described as a sensation of pressure, squeezing, heaviness, or burning. The feeling may even radiate to other areas like the shoulders, arms, neck, jaw, or back. This discomfort becomes more pronounced during physical exertion or emotional stress because these activities increase the heart's demand for oxygen. When your heart rate rises, your heart muscle needs more oxygen to sustain the additional workload. However, with narrowed arteries, the necessary blood flow simply isn't there, creating an imbalance between demand and supply. This imbalance leads to what's known as ischemia, a shortage of oxygen that causes the sensation of chest pain. Additionally, in some cases, the plaque inside the artery may rupture, leading to the formation of a blood clot. This clot can partially or entirely block the artery, severely limiting or even cutting off blood flow to part of the heart muscle. When a blockage reaches this level, it can lead to a heart attack, where heart tissue begins to die due to lack of oxygen. This is why chest pain should never be ignored. It can be an early sign of something serious and requires prompt medical attention. The feeling of angina is also often confused with indigestion or heartburn because of the location and nature of the discomfort, which is why many people initially dismiss it. But unlike indigestion, angina doesn't improve with antacids and often follows a predictable pattern, coming on with activity or stress and easing with rest. Recognizing this pattern and understanding why it happens can be life-saving. Shortness of breath, also known as dyspnea, is another critical warning sign that your arteries may be blocked. Usually, when you're active, whether you're walking briskly, climbing stairs, or even engaging in light exercise, your body requires more oxygen to meet this demand. Your heart pumps faster and more forcefully to deliver oxygen-rich blood to your muscles and organs. However, when arteries are narrowed by plaque buildup, your heart struggles to circulate enough blood to satisfy this increased oxygen demand. As the blood flow to the heart becomes limited, the heart itself receives less oxygen. To compensate, the heart pumps harder, which not only strains the heart muscle, but also makes it less efficient. Without sufficient oxygen, your muscles and organs aren't able to perform at their usual levels, and you may start to feel unusually winded, even with minimal effort. This lack of oxygen impacts not just the heart, but also the lungs. When the oxygen supply to the body is limited, the brain triggers a sensation of breathlessness, urging you to breathe faster in an attempt to bring in more oxygen. Despite this increased breathing rate, the narrowed arteries restrict blood flow to the lungs and heart, so the body continues to feel deprived of oxygen. This is why your breathing may feel labored or insufficient. In more severe cases, this shortness of breath can even occur at rest, a sign that the heart may be struggling to supply blood to vital organs even under normal conditions. This symptom can be especially noticeable when lying flat or during sleep, as the pressure on the heart increases when you're lying down. This often causes people to wake up short of breath or feel a need to prop themselves up with extra pillows to breathe comfortably. Shortness of breath is particularly concerning because it can indicate that blood flow restriction is extensive and can be affecting multiple areas of the heart. If you notice that activities you used to handle easily now leave you winded, or if you're waking up in the night feeling breathless, it's essential to take it seriously. Third, fatigue or an overwhelming sense of weakness is a common but often overlooked symptom of artery blockages. This type of tiredness is different from feeling simply worn out. It's a persistent, bone-deep exhaustion that doesn't go away with rest. So, what's really happening inside the body to cause this? When your arteries are narrowed due to plaque buildup, blood flow becomes restricted. Blood carries oxygen and essential nutrients to every cell in your body, so when circulation is compromised, your organs and muscles can't get the energy they need to function correctly. The heart itself, which is working harder to pump blood through these narrow arteries, can become overtaxed. This reduces its efficiency and decreases the amount of oxygen-rich blood circulating throughout the body. As a result, your body goes into energy conservation mode where it prioritizes vital organs and reduces blood flow to less critical areas. This can lead to persistent fatigue as your muscles, brain, and other tissues are constantly starved for oxygen and nutrients. You might find yourself feeling drained even after a good night's sleep or struggling to get through simple daily activities like walking or climbing stairs. This is especially true if you're exerting yourself, as any additional energy demands push your body beyond its limited oxygen supply. Fatigue from artery blockages often builds slowly, creeping up on people who may initially attribute it to aging, stress, or a busy lifestyle. However, unlike typical tiredness, this type of fatigue doesn't improve with more rest. Instead, it can worsen over time if the underlying artery blockages remain untreated, eventually affecting your ability to enjoy or engage in activities you once found easy. This is why fatigue in the context of heart health can be such a significant red flag. If you're experiencing chronic fatigue, especially without an apparent cause, it's worth considering whether restricted blood flow may be at play. Fatigue linked to artery blockages is a warning that the heart and body are struggling to keep up with daily demands, signaling that it's time to consult with a healthcare provider for an evaluation. Identifying the cause early can allow you to make the necessary lifestyle changes or seek treatments that support heart health, helping to restore your energy and prevent further complications. Next, leg pain or cramps, especially during activities like walking, can be a significant warning sign of artery blockages known as claudication. This pain happens due to peripheral artery disease, PAD, a condition where arteries in the legs become narrowed or blocked by plaque buildup. This reduces blood flow to your lower extremities, limiting the oxygen and nutrients your leg muscles need to function, especially during physical activities. When you walk or exercise, your leg muscles require a steady supply of oxygen-rich blood to sustain movement. However, in people with PAD, the narrowed arteries can't deliver enough blood to meet this demand. The oxygen shortage causes a buildup of lactic acid and other byproducts in the muscle tissue, triggering the sensation of pain, cramping, or heaviness. This discomfort usually subsides with rest as the muscle oxygen demand decreases and circulation improves slightly, allowing the body to catch up on delivering blood to the affected areas. Claudication typically starts subtly, with pain that may come and go during activities like walking or climbing stairs. Over time, as artery blockages worsen, you might find that even shorter distances trigger discomfort, and the pain can become more intense. The location of the pain can also reveal where the blockage is. For example, pain in the calves often suggests blockages in the arteries farther down the leg, while thigh or buttock pain can indicate issues in larger arteries higher up. While PAD is most commonly associated with the legs, it's important to note that similar blockages can occur in other parts of the body, like the arms, which could lead to pain or cramping there as well. PAD is more than just an inconvenience. It signals that atherosclerosis is affecting multiple blood vessels, not just in the heart, but throughout the body. The next sign to be aware of is nausea or sudden sweating, which can be surprising symptoms of artery blockages, especially when they accompany more classic warning signs like chest pain. These reactions occur because the body is under significant stress when blood flow to the heart is restricted, and it responds by triggering the autonomic nervous system, the part of the nervous system that controls involuntary functions like heart rate, digestion, and sweating. When the heart isn't receiving enough oxygen due to blocked arteries, it struggles to keep up with the body's demands. In response, the brain initiates a stress reaction, activating the fight or flight response. This reaction releases stress hormones like adrenaline, which can cause you to break out in a cold sweat. The sweating might seem out of place, especially if you're not physically exerting yourself or in a comfortable environment, but it's a signal that your body is trying to cope with a lack of blood flow. Nausea, on the other hand, can also be triggered by reduced oxygen supply to the heart. When the heart is struggling, blood is diverted away from less essential functions like digestion to prioritize oxygen for vital organs. This disruption in the digestive process can lead to a feeling of nausea as the stomach is temporarily deprived of adequate blood flow. This combination of sweating and nausea can be incredibly confusing because these symptoms are often associated with other less severe issues, such as food poisoning, indigestion, or anxiety. However, if nausea and sweating occur alongside chest pain, shortness of breath, or other cardiovascular symptoms, it's crucial to take them seriously. These seemingly unrelated signs are actually the body's way of signaling that the heart is under strain and needs immediate attention. Heart palpitations, a feeling of your heart racing, pounding, or skipping beats, can be unsettling and may signal an underlying artery blockage. These palpitations occur because when arteries are narrowed or partially blocked, the heart often works harder to pump blood through these constricted pathways, leading to an increase in heart rate as it tries to meet the body's oxygen demands. The reduced blood flow to the heart muscle due to plaque buildup causes a condition called ischemia or oxygen shortage. When this happens, the heart may enter a state of arrhythmia, irregular heartbeat, as it struggles to circulate blood effectively. This irregular rhythm can make you feel as if your heart is fluttering or beating out of sync. In some cases, the heart compensates by speeding up, resulting in a rapid or racing heartbeat, which is the body's way of attempting to restore proper blood flow and oxygen levels to vital organs. Palpitations may also trigger a fight or flight response due to the sensation of stress or discomfort, which can further escalate your heart rate. During this response, adrenaline is released, which raises both heart rate and blood pressure, compounding the feeling of palpitations and creating a cycle that makes it harder for the heart to return to a normal rhythm. Heart palpitations are concerning on their own, but when paired with symptoms like chest pain, shortness of breath, or dizziness, they can indicate that the heart is working under strain due to artery blockages. While occasional palpitations can happen to anyone and may be triggered by stress, caffeine, or dehydration, persistent or severe palpitations may point to a more serious cardiovascular issue. Another vital factor, high blood pressure or hypertension, can be a critical warning sign when it comes to artery blockages, and it's one that can quietly cause damage for years without noticeable symptoms. Blood pressure refers to the force of blood pressing against artery walls as it flows through the body. When arteries are narrowed by plaque buildup, blood has less space to move, so the heart must pump harder to push blood through these restricted pathways. This increased force elevates blood pressure, putting extra strain on both the heart and the arterial walls. When the heart has to exert more effort to move blood, it can lead to the thickening of the heart muscle, especially the left ventricle, a condition called left ventricular hypertrophy. Over time, this thickening reduces the heart's efficiency and increases the risk of heart disease. Additionally, high blood pressure damages the lining of the blood vessels, making them more susceptible to plaque buildup and further narrowing, a vicious cycle that makes blockages progressively worse. One of the challenges with high blood pressure is that it's often referred to as a silent killer because it typically doesn't cause symptoms until it has progressed significantly. Many people may not realize they have high blood pressure until they experience a complication like a heart attack, stroke, or kidney damage, all of which can result from prolonged hypertension. High blood pressure is also a major risk factor for aneurysms, which are weakened, bulging areas in blood vessels that can burst under strain. Regular checkups are essential because they can catch high blood pressure early on, even before you experience any symptoms. If detected, healthcare providers may recommend lifestyle changes, medication, or both to bring blood pressure down and reduce the strain on the heart and arteries. Managing blood pressure is crucial in preventing further artery blockages and protecting overall cardiovascular health, as even slight reductions in blood pressure can significantly lower the risk of severe complications. Addressing high blood pressure early gives you a better chance at controlling artery blockages, preserving heart health, and preventing future problems before they arise. Swelling in the legs or feet, known as edema, is a common yet often overlooked sign that could indicate artery blockages or heart-related issues. When blood flow is restricted due to narrowed arteries, the heart struggles to pump efficiently. This inefficiency causes blood to pool in areas farthest from the heart, particularly in the lower extremities, where gravity plays a role. The buildup of blood in the veins increases pressure within the blood vessels, which pushes fluid out into surrounding tissues, leading to visible swelling in the legs, ankles, and feet. This pooling of blood and subsequent swelling can be uncomfortable and may feel tight or even tender to the touch. Swelling that appears suddenly or worsens over time is especially concerning, as it suggests that blood flow issues are becoming more severe. Edema is not only a sign of poor circulation, but can also indicate that the heart is struggling to meet the body's demands, particularly if other symptoms like shortness of breath or fatigue are also present. Changes in skin color or temperature, particularly in the extremities, can also be a warning sign of artery blockages. When blood flow is limited, less oxygen reaches areas like the hands and feet, which may appear pale, bluish, or colder than usual. This lack of oxygen can make your extremities feel cold to the touch, even in warm conditions, because blood vessels are struggling to deliver the necessary warmth and nutrients. These changes in skin color or temperature occur because the body naturally prioritizes blood flow to vital organs over peripheral areas when circulation is compromised. Reduced blood flow in the extremities is often an early sign of peripheral artery disease, PED-D, which, as mentioned, can signal the presence of widespread atherosclerosis affecting multiple blood vessels throughout the body. Recognizing these 9 signs of artery blockages is essential for maintaining your heart health. Each symptom reflects how your body is responding to reduced blood flow and oxygen delivery due to narrowing or blockage of your arteries. Thank you for watching. I hope you found this information helpful. Remember, paying attention to these warning signs can make a big difference in your health. Stay proactive, take care of your heart, and don't hesitate to reach out to a healthcare provider if you notice any of these symptoms. Please like, subscribe, and share this video to spread awareness, and take care of yourself.